everyone. Welcome to another episode of the Anti-Pharmacist Podcast. I must sincerely apologize for being AWOL on Friday. It's due to some technical errors that were unforeseen, right? And it was just out of my hands. I missed being in your ears as well. But here I am today in another week. So I know that you're forgiving me, right? How has your week been so far? I know it's a new week. I hope that you had a nice time at work today or wherever you are. So today, I'll be talking to you about another type of infection. You know, I've been doing a kind of infection series lately because, like I said when I started, I realized that community pharmacies, hospitals, these are the common complaints that most people have. Sometimes these issues are self-diagnosable, other times they're not, but the symptoms are kind of clear and these are preventable things, right? They are the ones that consume our money more. They are the ones that predispose people to antimicrobial resistance due to propensity or susceptibility to you self-medicating on these things, or even misdiagnosis in some cases. That is why I've decided to let us know about them, the risk factors, the prevention strategies, and the treatment options, so that the incidence of these kinds of infections in the society will reduce and the burden on our healthcare providing centers, our healthcare providers, and even our own self, our pocket, in terms of economy, will reduce. That is why I'll be talking to you again today about urinary tract infections. Yes, UTIs, urinary tract infections. I know a lot of people call them toilet disease, but that's just a layman term and it kind of doesn't define anything. What do you mean by toilet disease? When somebody comes into the pharmacy and say, pharmacist, I have toilet disease, either male or female, you might think that you're communicating something, but in actual fact, you haven't said anything. Everybody goes to the toilet, and there are many other diseases that you can actually get from maybe visiting the toilet. So how do I know? But I'll be talking specifically about urinary tract infections, what you should know about them, the risk factors, how you should avoid them, and of course, treatment options. I will never mention a particular medication for you on this podcast, but I'll tell you like home remedies, what to do. Of course, you have to meet your healthcare provider for all your medication advice. I'm an advocate of no self-medication, so I will not be reading out any names for you to go and buy from one roadside chemist. No. So without further ado, let me just get right into it. So what are urinary tract infections? Otherwise known as UTIs, they are infections of any part of the urinary tract. That is your kidneys, your bladders, or your urethra. That is that part of the body which the urine passes out of the body. Okay, and they occur in about 1.5 million people in Nigeria yearly, including children as young as neonates and infants. That is, babies that are months old can get these infections. They are one of the commonest infections encountered in community pharmacies and healthcare facilities worldwide, especially in Nigeria that I'm speaking from. I've said it earlier, okay? And it has been found that they occur more frequently in females than males because of the anatomy of the urinary tract of the females. You see, females have shorter urethra with opening closer to the anus compared to the male. You understand? So this makes them more susceptible to these infections. And these infections are of different categories. They're of different types, okay? We have infections of the upper urinary tract, while we have those of the lower urinary tract. There is the pyelonephritis, which is infection of the kidneys, which can occur in males and females. That is the major upper urinary tract infection. While the likes of cystitis, which is infection of the bladder, prostatitis, infection of the prostate, epididymitis, infection of the epididymis, urethritis, which is infection of the urethra, and orchitis, infection of the testicles, are lower urinary tract infections. We also have candidiuria, which majorly occurs in women but can also occur in some males. They can be classified also as uncomplicated and complicated. Majorly, uncomplicated urinary tract infections involve the lower urinary tract, while the complicated usually involves the upper urinary tract, which is the kidneys. You know why we call that complicated? Because it must have become chronic. It travels from the lower parts of the anatomy upwards. So if it is not arrested quickly, this infection, the bacteria or the causal organism, if they are not arrested with the right medications or treatment approach quickly, they travel up, infecting the kidney. That is when it becomes complicated. All right. Now to the causes of these infections. I mentioned the likes of cystitis, which is of the bladder. There are some that occur in male, because that part of the anatomy, the urinary tract that is affected, is only present in the male. The likes of the epididymitis, prostatitis, orchitis, they occur in males because, well, they are the ones that have that in their anatomy, their urinary tract. Now, the causes. The causal organism in most cases of UTI is a bacteria called E. coli, Escherichia coli, because it is the most abundant organism in the gastrointestinal tract of humans. And urinary tract infections are mostly gotten through the transfer of this organism from the anal region to the urinary tract. When you're passing your excreta, if you do not clean up well, those are some of the causes. This bacteria travels from your anus to your urinary tract. That is why females are more susceptible, because of that short distance between the anus and their urinary tract, right? There are other bacteria that cause this infection, although not at the frequency of E. coli. Examples are Enterococcus, Proteus mirabilis, Klebsiella pneumoniae, Staphylococcus aureus, Pseudomonas aeruginosa, Chlamydia trachomastis. Okay. UTIs can also be caused by viruses, such as mumps and varicella, and this results in orchitis, that is, inflammation of one or both of the testicles. It can also be caused by fungi, which is the Candida albicans. That's the one that causes candidiuria. Now, there are some risk factors that, if one is exposed to, predisposes you to getting a UTI. Number one is urinary obstruction. If you have any case that has caused your bladder to be blocked such that you cannot pass out urine, the storage of that urine for long in your bladder can result to infection. Then gender, I've mentioned that females are more susceptible. Age, males above 50 years. These are people that are predisposed to having BPH, that is benign prostatic hyperplasia, which causes urine incontinence, frequency in urination, and all of that. That could also predispose you to a urinary tract infection, especially prostatitis. Then catheterization. People that have been bedridden for a while, they can't get up to ease themselves. They have catheter connected to the urinary tract for excretion of urine. This could cause them to be susceptible to urinary tract infection, maybe from the process of attaching the catheter or removal. Then those that have gone through urologic surgeries too, they are susceptible, because those sites of incision can become infected, right, transferring or traveling to other parts of the urinary tract. Then there's sexual intercourse. I would like to correct the notion that only sexually transmitted infections can be transmitted through sex. I don't know if you understand that it's only gonorrhea, it's only chlamydia or syphilis. I mentioned some of these diseases on the episode about sexually transmitted infections, but no, remember that I mentioned sexual contact and there's sexual intercourse. Now, these urinary tract infections can also be transmitted through sexual intercourse. It has been proven by research, by science, that there are some urinary tract infections that are actually transmitted through sex. So if you find a causal organism that is usually not one that causes a sexually transmitted infection, the like of your E. coli, but then you could get it through sexual intercourse. This is why you should be careful. Also, lack of circumcision causes urinary tract infection. It makes your genitals, your genitalia, more sensitive and more susceptible to these microorganisms. Then compromised immunity. That is one thing that can predispose you to generally different types of infection. When your immunity is low, maybe due to pregnancy or due to some diseases like human immunodeficiency virus, which is HIV, your body is not able to fight off some infections. Therefore, you can get some of these infections I'm talking about. Another is disease conditions. There are some disease conditions that will lower your immunity naturally or increase urine output, make you urinate more than usual, or cause obstruction, as the case may be. Examples are diabetes. Diabetes causes polyuria, that is increased urination. Rheumatoid arthritis, that one reduces your mobility. You're not able to move around. You might just begin to hold your urine because you don't want to move around too much. Also, tuberculosis can predispose you to urinary tract infections. Now, going to the signs and symptoms of these UTIs. They are really not difficult to pinpoint. That's why I said earlier in the introductory part of this episode that some are self-diagnosable. When you start seeing some things, you know that, oh, this is what I have. That's why people will just walk in and tell the pharmacist or doctor that, I know I have toilet disease. Do you understand? One of the major signs or symptoms of UTIs is dysuria, that is abnormal urination. Either it's not coming out as frequently as it should, or it is coming out too much, or there's pain during urination, or there are trickles, after you have urinated, you still have some falling on your skin. Yes, that's what dysuria is. Another is hematuria, that's blood in urine. When you start urinating and you see blood, it might just be UTI. I'm not saying it is definitely UTI, but it is one of the symptoms. That is why you should see your healthcare provider, and that's why they are not totally self-diagnosable, because it might be something else. Except differential diagnosis is done to specifically pinpoint the organism, you may not conclude, but there are things to look out for. Okay. Another one is tachycardia, that is increased heart rate. When this infectious organism travels maybe to your kidney, for example, it could affect your blood pressure, it could affect your heart rate. Do you understand? Then urinary urgency, urinary frequency, I've mentioned that under dysuria. Okay, there's hesitancy as well. You want to go to the toilet, you are feeling like that thing is burning you. You get to the toilet and it's not coming out. That is hesitancy. Then urinary dribbling and slow stream, especially for men. You are supposed to have a particular pressure of your urine. There's a particular trajectory or projectile that is supposed to form, but then it just starts flailing. Do you understand what I'm saying? It starts dribbling. It's not in the usual line that you used to go. You cannot even target it into your water closet anymore, or your toilet. Then that could be a sign of urinary tract infection. Then flank pain. We call your flank the area near your pelvis. That's your flank area. When you start feeling pain at the back, it could just be a UTI. Then fever. Most infections come with fever because your body is trying to react to that foreign organism that's taking possession of your body. Okay. Now let's look at preventive strategies for UTIs. I always say on this podcast, prevention is better than cure. There's nothing you can say about it. And sometimes prevention is even the cure. I've mentioned it several times. So you should pay attention to preventive strategies that I share on this podcast, because it is better not to have some of these infections than to have them. I mentioned part of the risk factors. Previous infections or diseases could even predispose you to other diseases. It's like you have a population of microorganisms before, you were able to treat it, thankfully, but then maybe you still had some trickles, some little population in your body. They could just grow back when your immunity reduces, maybe due to stress or due to a disease. So you could come down with that disease again because, your body has been introduced to that microorganism, or that microorganism is still present in your body but at a suboptimal population for infection. I hope you understand me. So it's better to not have these diseases at all than to have them and treat them, because they could just resurrect, they could come back. All right, so prevention of UTIs. There are some things that you can do to actually prevent UTIs. When you do these things consciously, they become habits, and before you know it, you don't have to spend your money on medications. Number one is taking cranberry juice. It has been found to be beneficial in preventing UTIs in all age groups because research has shown that it prevents E. coli, the commonest causal organisms from the gut, from adhering to human uroepithelium. The uroepithelium meaning the lining of your urinary tract infection. Okay, so when you take cranberry juice, research has shown that it is very beneficial both for men and women, for children of all ages, to prevent this infection. So why not make it part of your routine? Take juice. It's from a fruit. It will give you vitamins, boost your immunity, while at the same time preventing this illness. Okay, then drinking a lot of water also helps, as it causes diuresis, which helps to push out the pathogenic organism from the urinary tract. Drink a lot of water. We've said it over and over again. When you drink enough water, you pass a healthy amount of urine out of your body system, which can even help you to push out some of these microorganisms that may be adhering to your urinary tract. Then proper hygiene in the use of toilets and wiping down from front to back. That can never be overemphasized. When you use the toilet, please ensure proper hygiene. Not only in washing your hands this time, but even in washing down there. If you use the toilet, you pass out feces, make sure that you wash your anus very well. We have said it that this microorganism passes majorly from the anal region to your urinary tract. Wash it, make sure that there is no speck of feces left. Those that use toilet roll to clean, make sure that you clean everything well, not just to smear everywhere and leave it like that. Even the space between your buttocks, it's been said that some people do not even know how to clean that part, and when some open it, it is something else. Please clean it well and wipe from front to the back, not from back to the front. You know, it is common then when maybe children, you just wash from your anal region up to your urinary tract. It is dangerous. You could just be introducing microorganisms to your urinary tract that way. Wash from front to the back. Okay, that is one preventive strategy. Another is using of barriers during sexual intercourse. It's not only to prevent sexually transmitted infection, as you have learned today, but also to prevent UTI causing organisms. Did you know that even Neisseria gonorrhea causes urinary tract infection? Yes, gonorrhea. It doesn't only cause that gonorrhea, which is an STI, it also causes UTI. You know, infections can be classified based on where they occur, which I've been doing: your respiratory tract, your urinary tract, your skin infection in terms of the ringworm, the scalp. Do you understand? So when the organism is present in your urinary tract, causing discomfort there, making you sick, then it's a urinary tract infection at that point. So gonorrhea is not a urinary tract infection, but the causal organism Neisseria gonorrhea could actually cause a urinary tract infection. So please take that home today. Then, to prevent these urinary tract infections in children, make sure that they go to the toilet when they should. Okay, do not encourage them to hold their urine. And for babies that still use diapers, change their diapers frequently. Do not let the diaper be so soaked with urine, being on their skin for long without changing it. You know, when baby starts crying due to discomfort, try and find out. It might be that the diapers are so wet. This could predispose them to urinary tract infections, especially knowing that their immunities are not so strong. Also, discourage them from going around bare-bottomed. Do you understand? This could expose them to different microorganisms in the environment, getting into their urinary tract or even into their anal region, which can later on be transferred to their urinary tract. All right. The last preventive strategy, there might be more, but the last I want to share today is voiding after sexual intercourse. So I've told you that voiding, urinating could help to push out some urinary tract infection causing organisms. So after sexual intercourse, let's say by some chance a causal organism has been transferred to you by your partner, when you go to the toilet immediately after, you could just flush that thing out before it establishes an infection. That is majorly it. Okay, now to treatments. I've told you that I will not be mentioning medications. There are many medications that can be used to treat these infections, and they are actually determined by your symptoms sometimes, which is not the effective way. I've mentioned that carrying out definitive microbial culture sensitivity tests is the best way. You go to your lab, you do your urine MCS, that's urine microbial culture sensitivity test, and your result comes out. It tells us the microorganism involved. Then we deploy the best medication to combat it. Your own duty is to visit your healthcare provider, complain about your symptoms, do what you're told to do in terms of carrying out tests, and take your medication as you should. Okay, there are many classes of antimicrobials, antibacterials, antifungals, antivirals, depending on the causal organism that can be used to treat. Just to give you some tips about treatment of these UTIs, it has been found that previous antibiotics exposure can cause drug-resistant UTIs, which is why we advise you not to self-medicate. It's for your own good. So if you have been abusing antibiotics, this is your cue to stop, because your previous exposure to some classes of antibiotics, maybe penicillins, for example, could actually make it more difficult to treat your UTI. So do not take medication until expressly recommended by your healthcare provider, and that is when you actually need these medications. Also, duration of therapy. Usually, duration of therapy should not be more than 7 days, because additional days are not beneficial. So when you are given this medication, you are told to take it for 7 days. Don't overdo and take for 10 days. You might just be wasting your time. I'm sure that you even be given for the number of days that you need, so there will be no need for overuse and being exposed to the adverse drug reactions. Okay, then there are some therapies called adjunct therapies, so things that you can use in combination with your antimicrobials for treatment. The likes of your mixed pot citrate. It's a mixed potassium citrate solution that you can use alongside your antibiotics to reduce the level of acidity of your urine, thereby relieving the irritation and burning sensation, especially in bladder infections. Okay, so that can be given to you as well, and you'll be wondering, why am I giving this liquid to take instead of capsule or tablet? Well, it's usually used as adjunct therapy. All right, sometimes your healthcare provider might decide to treat you for both UTIs and STIs. Don't be surprised, especially if you're sexually active. Their symptoms are closely related. Okay, and the commonest pathogens that can be shared between these two are your Neisseria gonorrhea, like I mentioned, and your Chlamydia trachomastis. In conclusion, UTIs are treatable, very treatable, but they tend to be recurrent because of the function of the urinary tract, which is an organ of excretion of urine, and also its proximity to sexual organs. So that's why I said it's better to not have it than to have it, because it can reoccur at any time. These organisms, they are very sticky, let me put it that way. They can stick to the epithelium of your urinary tract before you know it. Even though you have used a medication to try and get rid of them, they can just reoccur. Don't say that your healthcare provider does not know what they are doing because they gave you this medication, it went away, and after like 2 or 3 weeks you are done with it again. No, these are recurrent microorganisms and infections. Okay, I've told you that antimicrobial resistance is a thing, so please don't play with antibiotics or antivirals or antifungals. Don't joke with them. Use them only when necessary at the recommendation of your healthcare provider. Okay, it is not advisable for you to say you want to use low dose antibiotics for prophylaxis. This could result in resistance and predispose you to another episode of UTI. So don't go to your pharmacy and start asking for 1 capsule of ampiclox, 1 capsule of amoxicillin, 2 tablets of Septrin. It's not advisable. Use those preventive measures that I mentioned earlier. Taking a lot of water or sufficient as you may seem fit, taking cranberry juice, maintaining impeccable hygiene in that area, and you will not come down with urinary tract infections. You know, people believe that it's when they share toilets with people that, you know, when you use public toilets, that you come down with these infections. But if you do your own part by maintaining impeccable hygiene and you clean your toilet well, even if you share it with others before you use this toilet, use your antiseptics to clean the toilet, clean the surfaces of your water closet, the places you will touch Make sure that you clean them, and after you have used them, flush appropriately, wash your hands with soap and running water. I don't believe that you will come down with these urinary tract infections, because it might even be more dangerous for you to start visiting bushes to do your business than to use that public toilet. Just take these preventive measures that I've mentioned, maintain hygiene, and you see that the frequency of going to always complain about toilet infections will reduce drastically. Trust me, I hope that I've been able to do justice to this topic today. But if you feel like I didn't mention something that you're curious about, feel free to mention it in the comments, okay? Send me a DM on my social media platforms. You know what they are already, okay? Or send me a mail. Guys, I've been getting calls for collaboration, okay? And I'm trying to fit schedules, okay? You know that this is not easy. Having to slot guests into schedules, making sure that we're on the same page, making sure that what we're discussing we align to the podcast goals and also will be beneficial to you. So very soon, guys, expect more guests on this platform to discuss topics that will be beneficial to you, to your health and general well-being, okay? In light of that, if you're a content creator like myself, you care about health, global health, public health, skin health, whatever kind of health, okay, you can reach out to me on my mail at antipharmacistpodcast@gmail.com. Let's collaborate. Let's do something nice together for our listeners and for people all over the world, okay? I'm open. And if you have suggestions for me for topics you want to hear, please do not hesitate to send them to me as well. Do not forget, dear anti-pharmacist too, I'm here to answer your questions. Do not forget, dear anti-pharmacist too, I'm here to answer your questions. As soon as I receive another mail asking a question that I know will be beneficial to everybody, I'll share it on one of the episodes, okay? So watch out for that. Thank you so much for supporting me always. Do not forget that I also share my topics and my insights about them on my LinkedIn page at Bemisola Adebisi Jose. Please and please help me to subscribe to my YouTube channel. It is very important to me. Help me to grow that channel for more visibility. Comment. Do not just listen to the podcast. Comment, share, like, and subscribe, most importantly, so that we can reach more people all over the world. Thank you once again for listening. I wish you a very nice week ahead. Till I see you next time, stay healthy and God bless you. Bye.